Hi, I'm Stephanie. This is Ashley. We're going to teach you the basics of applying a splint today. I have a quick little diagram to show you. We're going to show you a volar splint, pretty simple, so that way you can get the actual splinting process. Already pre-cut things to try to make this go a little bit faster for you guys. So this is a stockinette. Typically it's on a roll you'll have to cut, and I cut a little hole in his thumb for him already. This is kind of doctor discretion whether or not you use it, primarily if you have like an abrasion, a wound that we're trying to protect. Want to make sure there's no wrinkles, we put this on. Cotton wrap, your fiberglass, and your ACE wraps. So if I'm doing a volar splint for him, like let's say he has abrasions and things like that we're going to protect. First we're going to clean him out, make sure there's nothing in there. I'm also going to want a baseline neurovascular check. Because if he has strong pulses, no numbness or tingling, anything like that the whole time, and then all of a sudden I put a splint on and we have where he can't move his fingers all of a sudden and he's having that numbness and tingling, that's our first indication that we have a problem. We could be thinking about compartment syndrome. So having a baseline, I want to make sure there's no wrinkles. And like I said, this is not always used, just sometimes. Next is going to be our cotton wrap. Anytime you're wrapping, you're going from distal to proximal. I want the most amount of compression at the end, and I'm wanting to protect everything. So I'm going to wrap this cotton wrap through here. If I was doing, like let's say an ulnar gutter, or you might have heard it called a boxer splint, and I have to wrap fingers, then I would be wanting to make sure if I'm wrapping, like coming up these fingers, I'm also wrapping in between any fingers. And I always want to leave the edges of the fingers or toes out, so that way we can do the cap refill checks. And I'm also, so the volar splint's only going to come probably down to here. I'm always going to want my stocking and padding to go further in each direction so that I'm never having fiberglass touching the skin. I'm wanting this to be smooth. I want a little bit of overlapping in the hand where I'm protecting it. If I was worried about his thumb, if I needed to, I can even make a little hole through here and put another layer of padding around his thumb just to protect that and make sure that the fiberglass isn't touching anywhere on his skin. So now that I have that done, he's all wrapped. Oh yeah, so when I'm layering, you can kind of see that when I came through, that about 50% of my roll is showing. So I'm not rolling all in the same spot and creating bulkiness, and I don't have too many wrinkles. This is as smooth as possible, but we do have protection. If I was, let's say, wrapping up through an elbow in like a sugar tongue, I would want to make sure that I also possibly had another layer on anything bony, so that way we're not having any skin rubbing and irritation. So with these fiberglass, we're going to take this to the sink. We do not have to get this soaking wet, it's not plaster. So we're going to get a little bit wet, both sides, and then I already have my towel ready. And then before I got you guys on camera, you can either trim a little bit of this out or pull that this is covering this kind of abrasive edge you can see in there, because that rubs their skin, it's not nice. I'm going to go to my towel. I'm going to wrap this up in a towel to get the excess water off. This will get warm as we're going. So you want to warn your patient about that too, that nothing's wrong, it's just going to get warm as it's going through. Now, this is also always nice to have a friend. I'm going to go to get this shaped, and then Ashley's going to be able to help me in holding it in place once we're going to do our ACE wrap. So for this volar splint, you saw we're wanting protection up through his hand, and then this is probably for a wrist fracture. And so we have a little bit extra. And I can fold that back, that's okay. Yeah, if you don't mind grabbing down there. Now for wrists and hands, we're wanting that relaxed anatomical position. So like if you drop your hand down at your side, you don't hang out like this all the time or like a Barbie hand. You're just wanting like a relaxed wrist. If you're having an ankle, if you're doing a foot, you're wanting that at a 90-degree angle, same with your elbow. Because if you wrap somebody and their ankle is dropped like this, you're gonna create drop foot and have muscle issues. So your ankle's at 90 degrees, your joints are at 90 degrees, your wrist is just in a resting anatomical position. So I'm coming through here, I have this support here. When I'm molding, you'll see I'm using my hands and my palms, and I'm not using my fingers. If I use my fingers to push in on this, I can create prominences where it's rubbing into his skin and we can cause skin breakdown. So I'm using my palms, I'm wrapping down, I have these edges protected, his hands in that position, and then Ashley's holding back there. She's gonna hold that for me. I'm gonna grab my ACE wraps and I'm gonna start wrapping. Again, same thing, distal to proximal. I'm gonna go in through here, wrap around. All right, do one more just to make sure that we're covered here. And then we'll go down. If I was at a joint of some kind, like let's say we were doing the elbow on a sugar tongue, you see here how this is kind of sitting out. If we had a corner, we're gonna want to almost have it parallel with our skin. We do not want this where I'm pushing in and melding it, that it's cutting into the skin, especially at a joint. This is just sitting as a support. You can see his wrist is in a natural position. This ACE wrap's holding on. I'll wrap this one. We'll do one more. I also go, same thing as the padding, higher, leaving the fingers all exposed so I can check that cap refill. And then I want to go higher in the other directions as well. Because when you discharge them, not only are you gonna tell them not to get it wet, because you saw what happened, we got it wet the first time, or if you get a bunch of cotton wet, but also they cannot put anything down this cast or this splint. So if you have some extra wrapping up here to adhere, that's going to keep them crumbs and stuff from falling in. And we're keeping this loose up here. This is just to keep it closed. I'm not wanting more compression up here than up here. I'm wanting my least amount of pressure close to the patient. So we'll do a little twist here. Velcro down. So you can see I don't have any bulges other than this is where the fiberglass is split up. If I was concerned about this rubbing, I can even flip down this extra padding I have to make sure there's a nice barrier. If you're going above a joint, you're wanting at least 2 finger widths from that joint just to make sure this isn't rubbing up against his elbow. But you can see we've tightened this to his skin. We have plenty of padding. His arm's in this position. The most it would take if you got this soaking wet, it's like 5 minutes to dry, but I'm sure you can see and I can feel it's already getting firm and it's held in place. So if this was something that we're doing a sugar tongue, patient can't help at all, we have a little kid, even if just for 5 minutes, I need to just sit here and hold it in place, within 5 minutes, this will be firm and ready to go. So no getting wet, don't put anything down it. If you start seeing signs of compartment syndrome, let an MD know. If you're holding the splint in place, we can loosen the ACE wrap, but otherwise make sure they know not to take off the splint until they go to orthopedic. That's it.